Good afternoon, folks. I'm Myra Ansari here for Wave Now. We are going live to Frankfurt, where there is a press conference with the ACLU, the American Civil Liberties Union, and Planned Parenthood Alliance advocates and Kentucky legislators. They're going to be talking about abortion access in Kentucky.
And on abortion fails to recognize the many reasons that parents seek reproductive care, including abortion. The trigger ban is so heavy-handed that it has consequences that may have been unintentional, especially for those people who want to be parents but have had tragically complicated pregnancies. My journey to motherhood has been a challenging one. I lost my virginity at age 17 through rape. Fortunately, I was infertile, and that rape did not lead to a child. But I wonder what would have happened if that had been my story. I was so ashamed of what happened that I didn't tell anyone for years. It impacted my mental health. It impacted my education. It impacted my sense of self. 10 years passed. I met my husband in law school. We married fairly quickly between second and third year, and I was able to access good insurance as a student at University of Cincinnati. I was able to start seeing a very knowledgeable OBGYN and reproductive endocrinologist there at UC. He educated me a lot on the complications that I'd been experiencing relating to polycystic ovarian syndrome, or PCOS, which affects thousands of Kentuckian women. As he was treating me, I was really making progress. But of course, when I graduated, I was back to being self-pay, and I couldn't access the same doctor. Years went by again, and finally, my husband and I took a very substantial loan in order to pursue parenthood. Over $50,000, in fact. It was incredibly costly for us to pursue the dream and the joy of parenthood. For those who don't know, because of the lack of access to reproductive care we have in Kentucky, if you want to become a parent, there really aren't a lot of doctors who can help you if you're suffering from infertility. So there's a very limited number of doctors, even in the big cities like Lexington and Louisville. So I talked to friends, other women who had the same condition as I did, and they referred me to a specialist in Cincinnati. We went to the Institute for Reproductive Health in Cincinnati and had phenomenal care from doctors there. First, we tried IUIs. Unfortunately, those were not successful, so we moved on to IVF. And in 2020, our first embryo transfer was successful, our only embryo that was a girl. But I lost Beatrix at 8 weeks. I had a missed miscarriage. Many people don't even know what that is. You don't know. It happens in silence without any symptoms or warnings. So we went to our first appointment, and I was going to have my first ultrasound to see the baby and hear her and know she was there. And instead of hearing the sound of electrical impulses or heartbeat, we heard silence. My husband almost passed out. The doctor and nurse rushed to care for him because he was appropriately horrified that the baby we had been so excited to see a positive on the pregnancy test was no longer living. And that was in the midst of my primary run for the legislature. So here I am trying to do multiple really hard things, and I got dealt one of the worst blows in my entire life. The baby I wanted was not to be. But in a missed miscarriage, you don't have the dramatic bleeding episode. In fact, your body still believes that you're pregnant. And so I was still having all of the same symptoms. I was still having morning sickness. I was still bloated. I was having swollen ankles. All of these things where my body still believed that my baby was growing, although she wasn't. So my doctor gave me 3 options. You can do nothing and wait for your body to finally realize that Beatrix is gone. You can take medication that's typically treated as an abortion medication, and that will force your body to release the baby that's gone. Or you can have a D&C, and we can set a day and a time, and you'll be able to know what to expect, and you can manage your grief with some known expectations. Now, because my doctor was based out of Cincinnati at that point in time, even though there were restrictions in Kentucky, I was able to access a DNC in Cincinnati for Beatrix. I was grateful in the midst of my suffering because I knew what was going to happen. I knew that I was in control of what was happening to me, even though it all felt very much out of control. And so having the ability to know the day and time that that horrible nightmare was going to come to an end was a gift to me. And I'm incredibly grateful that I was able to access that care. A few months went by. My husband and I comforted each other and moved as much as we could on with life. And we went in for another embryo transfer. And this time we had 2 top grade embryos. And we decided that after all of the waiting and all of the heartache, we were going to make a big, bold choice and transfer 2 embryos with the hopes of having twins. Much to our delight, pregnancy test came back positive, and my hormone levels that they were measuring were shooting up, which indicated early on that, in fact, both of my twins were going to live. We went in for that first appointment. We held our breaths in the same room where we'd learned that Beatrix was gone. And we saw 2 living embryos. We rejoiced. We celebrated with our families. The doctor noted that one of them was smaller than the other. He said, we'll follow up in a couple weeks. If the second baby catches up, then things should be okay. So we held our breath for 2 more weeks. We came back. Twin A was growing and catching up with twin B. They actually measured the same. And so we rejoiced that it looked like things were going to be okay. For those of you who have not had this kind of journey, you don't realize how often you're going to the doctor for ultrasounds. Most women who are pregnant maybe get 3 or 4 ultrasounds maximum during their pregnancy. When you're doing an IVF type pregnancy, I had about 40 ultrasounds over the course of this pregnancy. So 2 weeks later, we came back for another ultrasound, and once again, baby A was lagging. We were referred to a maternal fetal medicine doctor in Lexington for ongoing care. After our very first ultrasound at maternal fetal medicine, I knew that something was wrong. Baby A was still behind, and he had a very large cystic hygroma, which is a mass, a bubble behind his neck, and it ran the entire length of his body. Babies typically have a very tiny, tiny sac behind their necks. He had a very large one. And so I brooded and I told my husband, it's not okay. He assured me it would be. We continued. The next appointment with the maternal fetal medicine doctor, she gave us the news. Twin A had a series of fatal fetal anomalies. Any one of them was like a 1 in 100,000 chance, but unfortunately my baby had 3. It's like 1 in a 10 million type chance, a perfect embryo that developed wrongly. He had something called the pentalogy of Cantrell, which means that his organs were developing outside of his body. His heart was outside of his body. His bladder was outside of his body. His lungs were outside of his body. He had the cystic hygroma, which was very large and extremely problematic. And he also had an open neural tube defect. So a neural tube defect you may have heard of. An open neural tube defect means that in his case, his spine stopped developing around his lung cage and he had no spine from his lungs down. The pentalogy of Cantrell can be treated by extremely skilled physicians. And so I started to try and find out who could help, because I'm not sure the percentages. A large number of those babies don't make it to birth, but there are in utero surgeries that can be done to save a baby who has that abnormality. But in a twin pregnancy, they can't do surgeries in utero. So our options were limited. I talked with experts at Cincinnati Children's about what we could do. And they said, there's not really a whole lot we can do, because even if we did this surgery and he was a singleton and there was no other baby to worry about, you're still going to have a child born that has no spine. That child will never walk. That child will never have bladder control. That child probably won't live to age 1. So I came back to my maternal fetal medicine doctor. She said, you have 2 options. You can wait until baby A passes on his own, which I believe he will before he's born. The positive of that is that you give him a chance. The negative of that is that you will probably have an active miscarriage when he dies, and that could compromise baby B. Baby B might be born too early, which would lead to any number of birth defects from a premature birth. Best case scenario, you would have a permanently disabled child and maybe another one. But chances are you will lose baby A and you might lose baby B also. What I would recommend is that you consider option B, which is called a selective termination. Now, that's not available in Kentucky, and I interrupted her. I said, well, I'm a brand new legislator. I'm really interested in why that's not available here. Can you talk to me about why I can't get this service in Kentucky? And she said, well, it's actually not because of the trigger ban or anything like that. Kentucky already has such a lack of OBGYN care and such a lack of experts that we don't have anybody here who can do that. And you're going to have to travel hundreds of miles to another state to find an expert who is capable of assisting you in saving the life of your other child. And so my husband and I retreated to our home, called our families, doubled down on our grief, and tried to figure out how we would move forward. Ultimately, we accepted a referral and went out of state for a selective reduction. That procedure carries with it risk of losing the unintended target of that procedure. You can lose your other child just because of disrupting that process. It's done on an outpatient basis. It was horrible and yet manageable. And so for 2 weeks, we again held our breaths and waited to see if we'd made it to the clear. Ezra, baby A, was gone, but we managed to save baby B, Ewan. I experienced anger. I experienced grief for my loss, for what could have been, for what was unthinkable to me that other parents who desperately wanted to be parents didn't have access in Kentucky to the services they needed. They didn't have access to the loans that they needed to be able to travel to another place in order to take care of their loved ones. And I speak very transparently. I loved all 3 of those children, and I still do. So when we talk about reproductive health care access in Kentucky, this is a more critical issue than people realize. This is not about teen moms who've made a mistake. This is about women and people who want to be mothers, who desperately want to experience being a parent, who don't have access to the care that they need because of the way we have pulled up the access. We have eliminated access that used to exist, and we didn't have enough to start with, and then we cut it down to nothing. This must be fixed. And that's why today I'm here to file 3 new bills. One I filed last year. We refer to it as the North Star Bill. It's a full reversal of all the detrimental legislation that's happened over the last 4 years. And it rolls us back to the access that should have and has been available in Kentucky over the last decades. I'm also introducing what we call the SHIELD bill. This is new legislation, not based on anything from a template. This is really unique to Kentucky, and I encourage you to take a look at it. The SHIELD bill provides that a parent who has to travel out of state to receive either an abortion or a medication-based abortion, that she doesn't have to worry about someone in Kentucky pulling her medical records, subpoenaing her, suing her, prosecuting her for taking care of her health and the health of her loved ones. This actually provides that the state of Kentucky cannot do that as a method of discovery and a prosecution. And it actually waives sovereign immunity so that if the state of Kentucky should do that to any woman who sought medical care out of state, they can be sued for violating that woman's civil rights. So this is really important because we've heard a lot of rhetoric and seen some actual action in the courts by people who would invade our privacy, take our most vulnerable moments and use them to hurt us further. That's unacceptable in a civilized society. And so the SHIELD bill is really important. And last but not least, I'm introducing a bill that I also introduced last session to add to the HANDS program, a component on maternal mental health, postpartum depression, and postpartum anxiety. For those families who take advantage of the benefit of the HANDS program, which is a Medicaid program, they can have someone come visit them at home, work with them with their new baby, provide access to services. And to me, it seemed like a glaring omission that in a state where we have high rates of maternal, we aren't talking more about postpartum anxiety and postpartum depression. So I think this is a very simple way that we can improve the lives of parents and children in Kentucky. This, to me, should be a very nonpartisan issue. We actually passed a similar bill last year, and this just takes it one little step further. There's a lot of opportunity for growth. We can do better by our people. We can make a difference with this legislation. And so I am honored to have with me today several people who I'd like to introduce to you who will be making remarks. The first person is Jackie McGranahan from the ACLU. Jackie, would you please come up? Thank you.
Thank you. Thank you very much, Representative Burr. Thank you for sharing your story and your experience. And thank you for filing this important legislation. I'm Jackie McGranahan. I am a senior policy strategist for the ACLU of Kentucky and an unwavering supporter of reproductive freedom in the Commonwealth. We are here to express our support and gratitude to Representative Lindsey Burke on the legislation filed today, repealing the current abortion bans. Thank you for your commitment to Kentucky, your commitment to restoring access, and your commitment to advocates and volunteers across the state who are looking for hope. Everyone in Kentucky needs access to health care. Pregnancy is a deeply complex and personal journey, one that can be filled with joy, but also challenges and difficult decisions. As advocates for reproductive rights, we understand that each and every individual's circumstances are unique, and we must respect their choices. The role of a parent requires immense love, dedication, and resources. It's also essential to recognize that not every pregnancy is planned, uncomplicated, or without great risk, especially to Black and Brown families. What we do know that's happening today in Kentucky is that maternal mortality rates, specifically for Black Kentuckians, are nearly 3 to 4 times, they are dying at 3 to 4 times the rate of their white counterparts. We know that maternal mortality is a severe crisis affecting many states in the United States, but especially states with severe abortion restrictions. We know this to be true. And when maternal health is a priority for Kentucky, restoring access to abortion has to be at the top of the list of priorities. For some families, including those in my community, facing unexpected pregnancies can be overwhelming. You're easily overburdened, and access to safe and legal abortion is a step towards ensuring families can make the best decision for their circumstances. This year, we also mark the 30th anniversary of reproductive justice. This is a framework that goes beyond just the legal right to abortion. It acknowledges that reproductive rights must be intertwined with broader social justice issues. It recognizes that the ability to make choices about our bodies is deeply connected to factors such as race, class, socioeconomic status, and we must strive for a world where every person has the resources, support, and freedom to make decisions that are right for them, free from discrimination and oppression. And it's important today to recognize that the fight for reproductive rights doesn't end with just restoring access to abortion. This will lay the foundation, but it is our responsibility to build upon it. What we do know is that these abortion restrictions are hurting our most vulnerable Kentuckians. When you have money and access, you're always going to be able to access an abortion. It's the folks who those barriers exist, who are having the most problems. And these are the people that we want to fight for. And the same barriers that existed before these abortion restrictions will exist once these are repealed. And there are Kentuckians in all regions of the state who do not have access to a primary care physician, let alone an OBGYN. We still have language and cultural barriers that limit access to health care. The racial disparities, like I just said a minute ago, are continuing to increase. And we still have a ways to go to create a Kentucky where parents feel safe and supported. And Kentucky has told lawmakers where they stand on abortion restrictions. Amendment 2 failed because voters know reproductive freedom includes access to safe and legal abortions. So repealing the current abortion ban in Kentucky is not about promoting one choice over another. It's about recognizing that pregnancy can be complicated. And it's our duty to ensure individuals have the autonomy to make decisions that are best for their health, their families, and their future. By supporting access, we are advocating for safer pregnancies, for the physical and mental well-being of families, for Kentuckians who may have already have children to care for, and for those who may not be prepared for parenthood. It's about compassion, empathy, and understanding that pregnancy isn't always straightforward. And we must trust individuals and healthcare professionals to make the choices that are right for them and not rely on the Kentucky General Assembly to make decisions about healthcare. Thank you.
Thank you, Jackie. And next, I'd like to introduce our next speaker, Katima Smith-Willis.
Good afternoon. Before I say anything, I want to really thank Representative Burke for you stepping up and for being a mother. I really do appreciate it. My name is Katima Smith-Willis, and I am here today as an advocate and as a proud Kentucky mother. Parenthood is a beautiful and life-altering journey, but it's also a path filled with uncertainties, challenges, and complications. I, too, myself, have a beautiful, and I'm blessed to have a beautiful 2-year-old son who is active and amazing and can use his 2 legs and use his brain to think. But I also have experienced loss as well. As a mother, I know firsthand the joys and the responsibilities that come along with raising children. It's a role that requires immense love, dedication, and a lot of resources and one heck of a village. But it's also essential to recognize that every pregnancy is complicated. For some mothers, including mothers in the Black community and all women and birthing people in the Commonwealth of Kentucky, facing unexpected pregnancies. It means making difficult decisions about the future, finances, and your own health at that risk. Access to safe and legal abortions ensures that mothers have the choice to make the best decision for their unique circumstances to protect their health, and to safeguard their family's well-being and future. Supporting access to abortion is not a statement against motherhood. It's a statement in support of the complex and often challenging journey that is motherhood. It's about trusting mothers to make the decisions that are right for them, their families, their futures, and everything above. It's also about recognizing that not all pregnancies are the same. Not all people are the same. Some mothers may be faced with high-risk pregnancies or severe health complications, and some mothers may experience pregnancies that were never meant to be life unviable. They need access to safe abortion as a medical option. By supporting this access, we are promoting healthier pregnancies, both physically and mentally, and ensuring that mothers can make the choice that are in the best interest of their families above all and anything else. Thank you. And thank you, Representative Burke.
Thank you so much. Next, we have Brittany Harris.
Thank you all for being here today, and thank you, Representative Burke. I would feel bad if I didn't say that sharing a story that way is such a brave thing to do. And I think that even if you're watching at home, wherever you're watching, if you have an abortion story or a difficult pregnancy story, I empower you to share that with somebody. I know that it's very difficult. And so I'm Brittany Harris, and I'm a Kentucky resident and a dedicated volunteer. And while I may not be a mother myself, I'm here to express my support for reproductive rights and why it's vital that all Kentuckians stand with mothers and parents in their decision-making process. Pregnancy is a complex journey, and access to abortion is essential because it acknowledges that parenthood is not always straightforward and that every individual's journey is unique. It's about recognizing that we must trust individuals to make the choices that are best for their lives, their families, and for their health. As a Kentuckian, I believe that supporting access to abortion is not only a matter of reproductive freedom, but also a matter of compassion and empathy. It's about ensuring that our state respects the autonomy of all individuals and allows them to navigate the complexities of pregnancy with dignity and choice. It's important to remember that pregnancy can bring about various complications, both physical and emotional. And I shouldn't have to live in a state that doesn't value my life during pregnancy. Supporting access to abortion means advocating for safer pregnancies, where individuals can make informed choices about their reproductive health. And it's about promoting the well-being of families across Kentucky. Thank you all.
Thank you so much. Next, we'd like to hear from Tamara Weeder of Planned Parenthood.
Thank you so much, Representative Burke. Hello, my name is Tamara Weeder, and I'm the Kentucky State Director for Planned Parenthood Alliance Advocates. I'm so grateful to be here today with Representative Lindsey Burke, the ACLU, and all of these incredible allies advocating to restore access to basic health care, abortion. Every Kentuckian should be able to access abortion care regardless of their reason, financial status, or location. Sadly, this is not our reality. In pursuit of anti-abortion policies, Kentucky legislators have become architects of intentional suffering while repeatedly turning a blind eye to the very real maternal health crisis in this state. The result becomes clear when we witness the denial of care to rape survivors, cancer patients, actions that were not unforeseen, but instead planned by the creators and supporters of these anti-abortion policies. The cruelty of these conditions are getting more and more difficult for the extremists to deny. 65,000 rape-related pregnancies have occurred in anti-abortion states since Roe was overturned, with as many as 3,000 here in Kentucky. Let that sink in. Kentucky has the third most pregnancies resulting from rape in the nation among states without abortion exemptions for rape survivors. Surviving the brutality of rape is hard enough. Being forced to remain pregnant after is profoundly wicked. Kentuckians are living with the consequences of these bans every day. Today, abortion is banned in all cases across the state, 0 exemptions except for life of the pregnant person, even if that exemption is placing Kentuckians in danger. In fact, giving birth is more dangerous than nearly every job in the United States, and it's 3 times or 4 times more dangerous for Black women. In Kentucky, more than 1 million people who can get pregnant are currently of reproductive age and then therefore could potentially need an abortion. If you happen to be one of these people and become pregnant, statistics reveal a stark reality that bringing a child into the world poses a greater risk than some of the most dangerous positions you could find yourself in. If you compare the mortality rate of police officers and the maternal mortality rate for Black women, a police officer would need to spend 3 years and 7 months in the field to face the risk equivalent to that of a Black woman giving birth to 1 child. Even soldiers on duty would have to spend 53 years and 8 months on deployment to reach the same level of risk. We have witnessed the effects of these racist and discriminatory restrictions have on our communities, especially rural communities, people with low incomes, people with disabilities, Black, Latino, Indigenous communities, member of the LGBTQ+ community, and so many others. Abortion bans make pregnancy less safe, period. Carrying a pregnancy to term is 33 times riskier for the pregnant person than having an abortion. One would think if becoming pregnant is so risky, shouldn't it at least be voluntary? Banning abortion does not stop people from needing an abortion. It just means that abortion care, fundamental health care, becomes only accessible to people with the means to travel for care. This is why Representative Burke's Shields bill is so important. Patients need to know that their medical information and care won't be under surveillance when they return home, and that they and their providers won't be criminalized. Anti-abortion lawmakers will stop at nothing in order to force a worldview that dictates a woman's role is to be pregnant and stay pregnant. In 2024, it's 2024, and this is our reality. A warning to Kentuckians as legislative agendas unfold. Don't be deceived. Bills proposed by the same people who created the conditions currently exacerbating negative maternal health outcomes today won't have realistic solutions to support pregnant people and families in the future. Access to healthcare should not be political. Representative Burke's bills place healthcare back in the hands of experts, not politicians. We know this is what the majority of Kentuckians want. They told us loud and clear when they voted no on Amendment 2 and voted to keep the ban out of our state constitution. This is because access to healthcare should not be political. To the legislators who think Kentuckians will forget these egregious acts against their basic rights to care, you don't forget the fear of being pregnant when you don't want to be. You don't forget when your doctor tells you they can't save your life because they are afraid they are going to jail. Or that your friend lost their life because a politician decided their beliefs were more important than their constituents' health care. Or the heartbreak of learning that a pregnancy is not viable. To the brave Kentuckians being forced into pregnancy, no, you are not alone. We are here for you. We will never stop fighting for you. To the Kentucky General Assembly, stop criminalizing our care and repeal the bans or be repealed.
Thank you so much. I hope that the public will look at these bills, take them, read them, understand them, ask questions about them. But I know that there are a lot of demands on your time. So if you feel compelled, please feel free to reach out to me to ask questions or any one of the people who have joined me today. It's my honor to carry these bills because I know I'm not alone. So thank you so much for being here today. And now I'll take some questions.
Representative Burke, does the SHIELD bill or any of these bills offer any protection for people who may be helping a person get out of state access abortion care?
The SHIELD bill does contain some provisions, especially relating to healthcare providers as well.
Representative, first, just want to say thank you for sharing the story and having people personal. How much does this connect to the letter that former Attorney General signed on with other Republican Attorney General relating to the access to these kind of medical records?
I think it speaks directly to that letter, and the current Attorney General has said that he does not subscribe to the position of Daniel Cameron, and I'm grateful to hear that. But I also heard that on his way out of power, Daniel Cameron was in the courts trying to get access to our medical records. So it's something that we ought to be vigilant about. It's not fair that someone should be forced into a horrible situation, make an impossible decision, and then have to live with the fear of being criminalized, attacked, doxxed, whatever, for the rest of their lives. So we need protection for people who seek care out of state, and the SHIELD bill is how we can protect other Kentuckians.
I know it's so early, but have you had any early conversations with any of the GOP lawmakers on whether they would get behind something like the SHIELD bill specifically?
I haven't been able to have those conversations yet. We have been working until the last minute on preparing the SHIELD bill. And so it has been filed today, and I'll be engaging those conversations as soon as possible to hopefully find some friendly faces across the aisle.
You said
The
you'll
North
be able
Star bill would be a reversal of the restrictions of the past 4 years. Can you just walk me through specific restrictions that those would?
I would. It's 112 pages, so there are a lot of them. A few examples. So there are huge regulatory regimes around doctors and hospitals, what they're required to report if they engage in providing an abortion to someone who fits under these restrictions. This bill, the North Star bill, is going back to the way that it has been my entire life up until the last couple of years. So this does not require a specific reason for seeking an abortion. It opens the pathways so that doctors are not curtailed. Doctors are not fearful of being criminalized or sued for providing this care. And it will ensure that other people like me who have no desire other than to become mothers can do that when they are faced with these unthinkable consequences. It really matters that in Kentucky, women of color, parents of color, are 4 times more likely to die as a result of childbirth. So this is a huge thing to block their access to healthcare. And that's why the North Star bill is better than any exceptions bill ever could be.
So is it basically a wholesale repeal of the abortion ban?
It is. It's a rollback to the way things were before any of those bills from the GOP were passed.
Back to the SHIELD bill, what's the basis of this being stated? Is it HIPAA or other federal protections?
HIPAA does provide a lot of protections for patients and their medical records, and so this is derivative in some ways of HIPAA. It's, from my perspective, establishing and formalizing rights that already exist to protect your medical records, and then taking that additional step of providing a civil right of action so that if your medical records are wrongly accessed, you have something you can do about it. You can take action in the courts, and that's the way it should be.
So like defense and offense together.
Yes.
Representative, how do you think your story is going to affect lawmakers' position on this issue, given how there's going to be an uphill battle here? Last year's bills didn't even get a hearing. How do you at least get a hearing?
That's a great question, because I think the truth is that there's very little appetite for change, at least among the supermajority. The reason I told my story today is that I want to highlight for people that there are many reasons that people need access to reproductive care. And the lack of access we have not only to abortion, but to simple OBGYN care in Kentucky is alarming. There are so many counties across the state where there are no OBGYNs. You have to leave your home to travel just to get a pap smear. This is not how it should be. And so by telling my story today, it's my hope that I will draw in some of the people who really do believe sincerely in the right to life, and to share with them and that I too want to be a parent. I love children. I want to see families grow, but I understand because of the life that I've lived, that's actually very complicated. And it's not always a straightforward, yay, we have a happy positive pregnancy test, 9 months, oh, I got a little sick to my tummy, but everything's okay, and now we have a baby. That's not reality. And so when we legislate like that's reality, it fails to recognize that a vast majority of pregnant people's experience is not like that.
Can you expand on the HANDS program, what that would add? Secondarily, additional question to that, are you concerned that maybe putting that with, or that it might get lumped in with the other two bills and people just view it as another anti-abortion thing, or that maybe that doesn't get considered either?
Well, that's an interesting question. So the third bill, the HANDS bill, is about providing additional information to families that self-select into the Medicaid HANDS program. So the HANDS program is available, it's offered, but it's not required for anyone. So the people who are participating already want the benefit of wraparound services after they leave the hospital. Just last night, I was talking to a friend who's a mother of 2 young children. And she told me, as she was reflecting on becoming a mother, that when she left the hospital with her first baby, she was just shocked that that day she was going to walk home and no one was going to check on her and make sure that she was okay. She said, you mean I just take this little tiny baby, this defenseless baby home, and I don't know how to be a mom? I've never been a mom before. There's nobody to come check on me and make sure I know how to breastfeed. There's nobody to make sure that my baby's growing appropriately. Nobody's going to come and make sure that I know how to prevent a SIDS death. And because she wasn't able to access the HANDS program, she didn't have the benefit of that kind of visit. So what this bill does is simply adds the provision of sharing information about postpartum anxiety and depression when these people are already welcomed into the home of the family that they're serving. So to me, it's a very incremental step to improve the well-being of mothers, parents, and children around the Commonwealth. And while it might be tempting for someone to lump that in with my other 2 bills, I think that'd be a crucial mistake. Because if what we care about, and I do believe that we have a shared belief here, that we want healthy Kentucky families, this is about as easy as it gets in terms of taking a proactive step toward making sure that we do. This is almost cost-free. You don't even have to print a pamphlet. You just have to say, by the way, how are you feeling? Did you know that it's really common for moms to experience anxiety when they never have? How, are you feeling anxious? It seems like a real common sense piece of legislation to me.
How do you think any of the 3 bills could help specifically Black mothers? Does it address that specifically? Maybe 5% of the month?
There are no provisions that are targeted specifically toward women of color or communities that are otherwise marginalized. However, by reopening access, we're ensuring that those mothers have a choice. And as they are facing worse pregnancy outcomes than white mothers in Kentucky and white mothers nationally, they can say, this is right for me and it's a chance I'm willing to take. It's something I do bravely. Or they can say, this is too much. I have other children at home I want to take care of, and the fear of what would happen if I passed is too much, and so I'm making this decision for myself and my family. The SHIELD bill also, I think, is really important to women who seek care out of state. And when I think of the way that we tend to over-police communities of color, it seems very likely that that would be true in this kind of circumstance too. If someone were to come after folks who've gone out of state, it's sadly, very likely they'd be going after vulnerable and marginalized communities first.
Is the SHIELD law, because the current trigger ban provides protection against prosecution, at least on paper, for women who get abortions or have an abortion attempted. Is the SHIELD law meant to try to go further to provide extra protections in case new laws are passed that change that?
Yes, it actually expands upon that, providing protection and immunity for doctors, groups that help people go to other places. And as we discussed before, it provides that ability to sue if your rights have been violated.
Do you believe there's a disconnect between, the thoughts within these buildings and the people of Kentucky? You said that it doesn't appear that there's an appetite to change things right now. How do you think that people of Kentucky will react to these buildings?
Well, it's my hope that the thousands of Kentuckians who are mobilizing through these different groups like the ACLU, Planned Parenthood, Protect Kentucky Access. I mean, there are a lot of groups. Kentuckians for Reproductive Freedom. I mean, there are about 10 groups I can name right off the top of my head who are doing incredible work at mobilizing Kentuckians who care about this issue. And so I'm honored today that I can provide the first pieces of legislation that we can really rally behind, because there is an appetite in Kentucky for change. And while there may not be at the General Assembly today, that appetite, the more these groups get mobilized, the more they speak to their lawmakers, I think we will get to a place where action will be required. And I look forward to that day.
I'm wondering if the ability to sue if your rights are violated under the SHIELD law, does that take any inspiration from what like anti-abortion laws have accomplished in other states, like in Texas, for example, anyone can sue related to abortion procedures? Is there kind of concern about there?
That's a really interesting point. That was not my intention in creating it, but it is a nice counterpoint to that type of legislation that seeks to criminalize and harm people who are seeking reproductive care. We have a fundamental right at issue here, and there should be no question that when someone seeks legal health care, wherever they do it, that they're protected. And we need to do whatever it takes to prevent people from being criminalized or sued or whatever. And I think putting these penalties shows everyone that we're serious.
Just for clarity, does the North Star bill repeal all the anti-abortion legislation passed since the Republicans won control of the legislature in 2017?
I want to say yes, that's the point in time at which we are setting the clock back, so to speak. Tamara has corrected me. It actually is a rollback to 2015, so a little bit further even than 2017. Thank you.
Is that everybody?
Thank you all so much.
Thank you very much.
All right, folks, thanks so much for staying with me here on this stream. As you heard some of the folks speaking today, Sean Bowdy is covering this story for us, and he's going to have much more coming up later on Wave News. I'm Myra Ansari. I hope you have a great day.